This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. Today on the program, we're speaking with seasoned author and finance expert, Dr. Murray Sabrin. He's a PhD and emeritus professor of finance at Ramapo College of New Jersey. Dr. Sabrin is considered a public intellectual for writing about the economy in scholarly and popular publications. His new book is The Finance of Healthcare Wellness and Innovative Approaches to Employee Medical Insurance. And Dr. Sabrin, thanks for joining us here today on eHealth Radio.
Well, I appreciate, Eric, to give your listeners my perspective on the issues facing healthcare and medical insurance in the country today.
And I'm sure listeners are anxious to hear what you have to say as well per your expertise, and thanks for your time. So for starters, how healthy are the American people in your opinion?
Well, according to the CDC's own website, the really big problem in America is chronic disease, and the numbers are staggering. 6 in 10 adults in the U.S. have a chronic disease. 4 in 10 adults have 2 or more. The cost of all medical care in the United States is $4.1 trillion. That's around 18% of GDP, by far the highest of any industrialized nation in the world. And we know what the diseases are. We have heart disease, cancer, chronic lung disease, stroke, Alzheimer's, diabetes, chronic kidney disease. And here's the amazing thing, Eric, from all the data that we have is that the underlying causes of a lot of these illnesses are lifestyle choices, tobacco use, poor nutrition, physical activity, excessive alcohol use. And I would add another thing, and that is hydration. I think it's so critical for people to be hydrated because we know that hydration is critical for all your bodily functions. It's all important for your organs. And it's important for the system to access the toxins that are in our body every single day because of the indoor pollution and outdoor pollution that we have. So when you add everything up, the choices that we make are reflected in the costs and the illnesses that the American people are suffering with.
One thing that grabbed my attention was the lack of hydration. That certainly is a challenge and an issue. People just do not intake enough water, so I'm glad you brought that up. How can wellness programs improve the health of employees? Get into that a little bit, if you would.
Well, this is the fascinating part about it. Ironically, employers have taken on the responsibility of their employees' health care through medical insurance. And this was not always the way in the United States. Through the quirk of tax policy during World War II, employers gave a tax-free benefit called health care insurance. And with that comes a lot of costs. And employers are trying to figure out can they lower their premiums, given the fact that just about every single thing is covered with medical insurance. And that's another thing that is kind of interesting is that ironically, when everyone talks about medical insurance, people think we need more medical insurance. Again, based upon everything I've learned in researching this topic for the last several years, we are overinsured. There's no need to have medical insurance to go to the doctor, see a sore throat. When I was growing up in New York City in the 1950s and 60s, and if we were ill, my parents would take me to the doctor. They would pay their $5 office visit. There was no copay, no deductibles, no insurance forms. If there was a prescription needed, you go to the local pharmacy, you fill the prescription. There was no insurance for that. And my father was a blue-collar worker making $3 an hour. And so everything was affordable in terms of health care. So we have to have a serious discussion in this country about what should be the structure of the medical care business. And with employers now paying a good portion of health care costs through premiums. And by the way, employees are paying more and more of their costs. Years ago, they would pay no amount of the premium. Now they're paying up to $7,000 a year, which comes right out of their wages. So there's a big issue with that. So what employers are doing, if they're really proactive in this area, they are hiring experts to develop wellness programs for their employees. But the key to that is some employers have wellness programs that do exceedingly well, and some just blow up in their face because the wellness program is not in tune with the culture of the workforce. And that's something that employers have to be sensitive to, is how do you deal with a wellness program where there may be pushback from employees who feel that, hey, this is not my boss's responsibility. I'm going to take care of my health care. But on the other hand, they want the employer to pay just about all their health care costs if something does go wrong.
Hey, good information and feedback there, and certainly see why you gave us that perspective. It does make sense. Why do most workers get health insurance through their employers? Any thoughts on that?
Well, it's because of World War II, and this is what happens when you have war. Not only do you have death and destruction and the huge cost of war, but it distorts various sectors of the economy, and in this case being medical care and healthcare. And so because employers got a tax-deductible benefit because they couldn't raise wages during World War II because of wage price controls under the FDR administration, they provided this tax-free benefit, and employees received a benefit that wasn't taxable. So everyone benefited. The employer got a tax deduction. The employees got a benefit that wasn't taxable. And this has been part of our culture now for more than 80 years, or just about 80 years. And so it's very hard for employers not to offer medical care or medical insurance because it's so ingrained in the worker's mind that that is a crucial benefit for them. And so as things evolve, we get Medicare and Medicaid in the mid-1960s, and then we get Obamacare in 2010. And so we have greater government involvement in medical care rather than less, which is what I would like to see, because I think the cost would go down, quality would go up, and we would have a much healthier workforce and country.
I'm sure listeners appreciate and like the sounds of that and really appreciate all the insight and information shared so far. Today we're visiting with seasoned author and finance expert Dr. Murray Sabrin, a PhD, and his new book is The Finance of Healthcare, Wellness and Innovative Approaches to Employee Medical Insurance here on eHealth Radio's Healthcare and Health News channels, a part of the eHealth Radio Network. Tell us also, why is traditional health insurance so expensive today?
Well, because it tries to cover too much. Like I said, there's no reason to have medical insurance to have a routine exam at the doctor's office or to have a blood test done because you're not feeling well and the doctor thinks, well, maybe there's something that we should check out in your blood test. And like I said, insurance, again, historically, insurance is for catastrophic loss. Going to the doctor for a minor ailment is not a catastrophic loss. We should be able to pay that out of our income, just as we pay for cable television or cell phone service or any other car repairs. We don't have insurance for small car repairs. We may get insurance for, let's say, if a transmission goes, and companies offer that without a problem. But insurance is really for the big items, big ticket items. And even those big ticket items can be reduced in cost dramatically. I'll give you one example. When I was researching my book on universal medical care, how we could have it in a free market setting, I spoke to a direct primary care doctor here in Southwest Florida, where I now live. And she told me the story of a patient who is uninsured, who does get direct primary care through her office, and he needed an operation. I forgot whether it was a hip or a knee operation. It was probably a knee, because the local hospital quoted him a price of $20,000. And he told the doctor that the hospital wants $20,000 for this operation. And she said, no, you've got to call the Surgery Center of Oklahoma, which is one of the innovators in having on-site a medical team to provide quality, low-cost care. He called up the Surgery Center of Oklahoma. They quoted him a price which included transportation to and from Oklahoma from Southwest Florida, a hospital stay, and all the aspects of medical care, $5,000. In other words, it was more than a 75% discount from what the hospital was charging him, because at a local hospital, he wouldn't have to have airfare and a hotel stay to go to Oklahoma. So my approach is, if we could have the Surgery Center of Oklahoma replicated throughout the country, we could lower the surgery costs of the American people by tens, if not hundreds of billions of dollars a year. And that will go right to the bottom line of corporations, businesses that wouldn't have to pay these exorbitant insurance rates.
Good stuff right there. Really appreciate that. And a lot of folks don't stop and think about the whys and why are things the way they are in these regards. So really appreciate your setting the record straight and bringing attention to it as well. Tell me, what are the alternatives when it comes to expensive health insurance?
Well, what's happening is businesses can work with the direct primary care physicians in their area, and the cost to the patient, to the customer, is, for a family of four, I've seen prices as low as $200 a month. So that would take care of your routine needs, which would include blood tests, visits, and this would be having access to the doctor 24/7. No waiting in the waiting room. You wouldn't have doctors with 15, 20-minute visits. With a direct primary care physician, you could probably spend a half hour to more to get a real diagnosis and a discussion of your illness. And from that, companies can then work with catastrophic insurance carriers to say, okay, if my employees need a major medical coverage, what would be the cost of that? And that would be much lower than what we have today, where you have these indemnity policies from the big companies, the Aetnas of the world, the United Health, the Cignas, Chubb, and all the other companies, Blue Cross Blue Shield, that are involved in providing health medical insurance for so many corporations. But companies are getting a little wiser, and they're self-insuring and using a third-party administrator to handle all the bills. The other thing that's really exciting for a lot of businesses, especially small businesses, is the medical sharing arrangement, whether it could be a secular or religious affiliation, where there are some guidelines where the customers have to follow. In other words, no smoking, no drinking, and so on and so forth, that would reduce your possible incidence of illness and disease. And those costs are very reasonable. It's not insurance per se, it's a cost sharing method, which, by the way, was the traditional approach prior to employee-based insurance from World War II. It was called the mutual aid societies, and that has a long tradition in America, where people would get together at the local level to deal with health care, to deal with unemployment, to deal with life insurance, to deal with funeral benefits. And so there's a great tradition in America of mutual aid societies, nonprofits, dealing with a lot of these issues that some people think can only be dealt with big mega corporations or government involvement.
We really appreciate your visit with us here today. And of course, you are the author of The Finance of Healthcare, Wellness, and Innovative Approaches to Employee Medical Insurance. Lastly, if you would, explain the silent revolution that is going on in healthcare today.
Well, I think the silent revolution is very simple, that employers and their employees are working toward lowering costs, increasing quality by using non-traditional method, which is the big insurance companies. And I think that's happening on a day-by-day basis as employers realize they cannot afford to spend $20,000 a year plus for an insurance policy for a family. And so if they can get those costs down, like the Rosen Health Resort, the Rosen Resort in Florida, which has been doing this for more than 20 years, saving a bundle of money for their employees. And that money goes right to other benefits like education for the employees' children and greater contributions to 401k plans. So there's a win-win by getting away from the traditional medical insurance to innovative approaches that employers are now using.
Dr. Sabrin, again, we thank you for what you do. And of course, if listeners wanted to pick up this book or get more information on the book or yourself, where's the best place to do so?
Well, Amazon is carrying the book. It's available on Amazon. It's been there for since it came out 2 months ago. In addition, I write on Substack, murraysabrin.substack.com, and I'll be addressing these issues as time goes on, because we just can't afford to have a $4 trillion medical care bill, national medical care bill, that increases 5 to 7% a year. But there's good news on the horizon. I think that's where the silent revolution comes in.
Again, Dr. Sabrin, thanks so much for taking a moment to be with us here today on eHealth Radio. Have a prosperous and healthy 2023.
Thank you so much, Eric. Same to you and your listeners.
And thank you. We've been speaking with seasoned author and finance expert, Dr. Murray Sabrin, a PhD, and his new book is The Finance of Healthcare, Wellness, and Innovative Approaches to Employee Medical Insurance. And for further details, visit either murraysabrin.com or murraysabrin.substack.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.